Good afternoon, everyone. My name is Beatrice Imieska. I'm your chairperson today from People for Public Services. I am also the chairperson of an organization called Inclusive Life Project. We work to empower women in our community, carer, people with disability, diversity, and ethnic minority. Let me introduce you today to our agenda. Welcome again. Who are People for Public Services? How our team live life work for you. I will then introduce you to our wonderful John Marshall, our Customer Experience Manager. And then the next step will be presented to you by a Division for Adult Social Care in Birmingham by Graeme Betts, the Director of Adult Social Care. This is the background of different meetings of showing you the picture of our services we've been doing since 2 years. This is the organizing team working to empower all of you. Welcome again. I will then now introduce you to our wonderful John Marshall, the customer who will take you through the learning the lesson from lockdown. Over to you, John. Thank you.
Good afternoon, everybody, and thank you, Beatrice. That was fantastic. So hello, as Beatrice said, my name's June Marshall. I'm the Customer Experience Manager for Birmingham City Council. And today I'm just going to be talking to you all about how to use the virtual forum. Professor Graeme Betts is following me, so he will talk to you about the vision for adult social care. But however, just before we start, Beatrice very kindly had a slide deck there of some face-to-face meetings. They seem like a long while ago now, if I'm honest. We were really lucky that we were able to have so many citizens who gave up their time willingly to come and tell us and help us improve services and tell us really what they thought. Unfortunately, we're no longer in that position. I do hope we'll get there eventually in the future, but who knows with COVID. So we're using a different approach now, which is this virtual forum. And the virtual forum brings us together in a safe environment. It's a new way of working. It does provide some challenges. Some of those challenges are obviously we're just talking to a computer screen, so we hope there's lots of people listening. So there is no responses back, but equally what we've got is able to an opportunity to update you on latest information in a monthly way using this Teams approach. In addition to that, what I will say to you is we can make improvements, and we are looking at what works and what doesn't. So we're always keen to learn. And what you will have is a Q&A document, a Q&A option button on your system. So my assistant, Simon, glamorous assistant, is identifying what it looks like for you. So it's a Q&A, so all you need to do, you can either ask a question anonymously or ask it with your name. And please do ask questions throughout the presentation. Graeme will take questions at the end of the session, but please do ask questions throughout because we will come to them and we will publish them. So all you do is type your question in there. If it's targeted at a person, a specific person, great. If not, we'll get the most appropriate person to answer it for you, and just press ask, and then that hits our live Q&A event. So now, without further ado, thank you very much for joining this afternoon. I'm going to pass you over to Graeme Betts. Thanks, Graeme.
Brilliant. Thank you very much, June, and thank you, Beatrice, as well. So I'm delighted to be on this call with you all today, and we'll just start running through the presentation now. So really this is about updating our vision and just being clear why we need a vision and why we need to keep it updated. I'm going to take the opportunity to review progress on delivering it and share that with you. And I'm going to talk about the changes that we need to respond to, because nothing stands still. I'll outline the principles that will underpin the vision going forward, and then I'll describe how we're going to take the vision moving forward. Okay. So, a good place to start is, why do we need a vision? And really, it's to set out the purpose and direction for the organisation. It's to ensure that we deliver our services in line with the purpose and direction. And it's an opportunity to review our delivery of services. And of course, it helps set standards for the organisation. One of the important things about our services, they need to be inclusive, they need to support vulnerable people. And of course, it needs to inform you about all of these matters. And there's no point in having a vision unless people are accountable for its delivery. So it helps clarify who's accountable for delivering it. And one question you might well ask us is, why does the vision need updating? If I go back to 2017, when I joined Birmingham, what was clear to me was that adult social services in Birmingham had lost their way and their sense of direction. And it seemed to me that when I spoke to citizens and staff, it wasn't at all clear what we were seeking to deliver. Of course, as well as that, the world moves on. That's, quite a long time we've been actually delivering the current vision. We need to learn lessons from it and review progress. The other thing to bear in mind is, and this is the reality of life in the public sector, that there is a savings programme attached to the delivering the vision. The council's constantly changing. We've got a new chief exec, for example. Of course, COVID-19 has impacted on all our lives. So if, just thinking about what June was saying, you might want to think about some questions to ask me on that section of the presentation. I won't pass over to you now, but if you could maybe jot down questions, send them into June and so on, and then we can answer them once we begin to get a few questions come in. Okay, so the big question, of course, is, what's the vision helped us achieve to date? I think the major ones have been improvements in the frontline social care, where we've improved our locality working and free conversations. So we've changed where we work, how we deliver the service, and we've also introduced some more specialist services like family group conferencing and the community network support officers. And all of these changes are helping to improve the delivery of frontline services. In terms of savings, the programme's delivered well. Neighbourhood network services I've touched on, and preparation for adulthood. These are both areas that we'll continue to develop going forward. And one of the big changes we made was through our commissioning framework. I think people often forget that in reality, the vast bulk of services are delivered by independent organisations, and all of those have to be commissioned. And of course, we've implemented the customer journey to support the locality-based working in free conversations. Not everything has gone to plan as well as we would have liked, and we haven't made as much progress on day opportunities and enablement as we would have liked, but we'll be coming back with further proposals on these. Now, I did say that we would outline the changes we need to respond to. We've got a new chief exec who's currently talking to members and officers, and he'll no doubt talk to citizens as well about the delivery plan. An obvious change we need to respond to is COVID-19. It's had a huge impact on our service delivery. And what it has done is throw a spotlight on inequalities. I think we're all aware that we live in an unequal society, but COVID-19 has really shown how unequal it is and reinforced those inequalities. Another big change we need to respond to is Black Lives Matter. We've seen the response worldwide to the murder of black men in America, and we need to respond to that. I think we're pretty sure we're going to face a difficult winter, as well as COVID. We'll face seasonal flu, and also, over the period of time we've been running emergency services, inevitably there is a risk about, this staff and their ability to continue to deliver services. And of course, if that's not enough, hot on the heels of a difficult winter, we know that we'll be in the process of leaving the European Union. So the whole issues about Brexit. There have been changes which have arisen from COVID-19 and how we've worked. We've introduced a new model of discharging people from hospitals, both to improve the outcomes we achieve and to make it quicker for people, so they don't remain delayed in hospital. Supporting that, we've introduced a new service called Early Intervention, which seeks to help people avoid hospital admission, and if they are admitted, to bring them back into the community quicker. And of course, like everybody, all our staff have had to get used to working with the new technology, video conference and so on. In terms of day opportunities, because we've had to close the day centres at the moment, and we're still looking to see how we can open them, we've had to change the way we deliver day opportunities. Residential homes as well have experienced certainly a decline in the number of people wanting to go into them. Other changes we're making, we're looking to rapidly increase our use of assistive technology, and we are improving our joint commissioning with the clinical commissioning groups to get better value for the money we spend on commissioned services. And of course, as we are today, we're beginning to develop new ways of engaging and co-producing with our citizens. So again, you might want to reflect on the points I've made at this, at this point in the presentation, and think about questions you might like to ask me about the changes that I've described and so on. So I'll give you just a moment to reflect on that and begin to think about the principles that underpin the current vision. And they were always, the vision itself was always meant to be simple and straightforward and reflect what people, what people in the citizens in Birmingham want for themselves and their families. And when you think about that, the first thing you really need is information. We can't do much in terms of getting better services without good quality information, advice and guidance. And we need a wide range of community assets, because what makes the quality of people's lives good isn't just the formal services they receive, but it's also those community assets in the community. We've always been convinced that prevention is better than cure, and that's why we have invested into prevention and early intervention services. And we've been committed to co-producing our services with citizens, with staff and with partners. Other principles we've based the vision on are making safeguarding personal. Even when people are most challenged in their lives, when things are going well, we can still make safeguarding personal. We know we need to use resources effectively. Over the past dozen years or so, we've seen the amount of money invested in adult social care decline. And personalised support is at the heart of what we do. It's an absolutely fundamental building block for everything we do. And then finally, we know that our services need to be integrated and built on partnerships with citizens and partners in NHS and the third sector, community groups and so on. So the question we really had to ask ourselves were, are the principles as relevant now as they were 3 years ago? And I think the broad answer was yes, they are. They, you know, from what I've just described as building blocks, they seem the right things still to us. But also taking account of the changes we've seen over the past few years in terms of COVID, the impact of COVID, Black Lives Matter, we felt that social justice needs to be included as a guiding principle. And on that basis, it was proposed to add the principle that people should expect to be treated equally and fairly. Services shouldn't discriminate on any grounds against citizens. Services should seek to improve social justice by tackling the reasons for discrimination and creating opportunities for all citizens. I think in adult social care, social justice is at the heart of what we do, and I think it's absolutely appropriate that we strengthen our vision by adding a stronger reference to social justice. But of course, no vision is of any value unless we take it forward, and we will be putting in place a strategic programme to help us do that. We'll build on the customer journey, which helps to improve the quality of the service people receive. We're developing the frontline adult social care services, including assessments, reviews and so on. We'll continue to build in and invest in our neighbourhood network services, which have been phenomenal, particularly during this really difficult period. And we'll continue to base our services and improvements on community. We talked about partnerships, and one of the most successful partnerships over the past few years has been the Birmingham Older People Programme. It's continuing to evolve and develop, and we will strengthen that with our partners. Another important partnership development is around preparation for adulthood and life course. That really difficult period when children become young adults and go on to become adults and then older people. And we want to think more about a life course approach. And we are working closely with colleagues in health and children's services to do that. We will develop more personalised day activities, being aware of the challenges we face with COVID. And as I said, we will have a programme around social justice. And of course, we continue to have co-production at the heart of developing and implementing our service changes. So in terms of the way forward and the engagement, we've been amending the latest draft. It actually was approved today at Cabinet, so that was good news. Cabinet were happy to approve it, so the vision has been approved. The next step now is to develop the strategic programmes. They're currently being drafted by my management team, and they're taking forward how all of those changes we've talked about will be delivered. We've been engaging our citizens and staff and partners in all of these conversations, and this today is part of that exercise. That really engagement exercise has taken place over the last 6 weeks. The Cabinet report has now been agreed, so that brings you bang up to date. And so I think that's the end of the presentation. So we're at the point now where we'll begin to look for questions and comments, and at this point I will hand back to you. Thank you.
Hi Graeme. So we have had some questions in. I have been publishing them so people can see what's come in and what's been published. So if I can just go back up to the top and throw some at you, if that's okay. This may have been answered during the session, but we've had an email, a question in from Jackie Nolan, asking what's worked well and what would you be looking to develop and continue? Do you want to take them individually or do you want to take them as a group?
Unmute, Graeme. Unmute.
You're on mute, Graeme.
I'm not. I've switched the settings.
Do you want to take that one, Graeme, or have you got internet issues?
No, I shouldn't have, but I pressed the button to unmute and it didn't unmute.
Right,
So,
you're live now.
Can you hear me now?
Yes, definitely.
Yeah, great. Yeah, I can take. I'll take them one at a time, if that's all right, unless you can see some that join up,
Okay.
June. In terms of things that have gone well with the vision, I think a number of things have been outlined in the presentation, but they're worth restating really. I think we made a big shift towards getting services more focused on citizens on the front line. And we did that in a number of ways. We've asked our teams to be much more closely aligned to the neighbourhoods that they serve, so that they know who the communities are, they know what where the community groups are, and that they're in touch with them, so they can respond in a more personalised and more effective way. And I think that's been the big change from what we used to do in the past. And to support that, we've invested into those third sector organisations. And that's the community groups at a very local level. And all of that, I think, has gone really, really well. And I think the proof of the pudding really was in the eating. When we went into lockdown and that dreadful period, within 2 days, those links that we had with the neighbourhood network services were up and running, and we were out there engaging people, identifying people who needed additional support, who needed, food, medicines, a whole range of things. And it was only because we had that local knowledge, and because we had, if I can put it this way, sort of boots on the ground, people really close to the action, that we were able to respond effectively. Now, we didn't design it with that in mind, but because of that, the way we had designed it, being very locally targeted and focused, I think that's how we were able to respond so effectively. So I think that's something that we do think we've got right, and we're going to continue to build on that and continue to invest in it.
Lovely. So, can you hear me?
Right,
next question. Brilliant. So I've got a couple of questions actually in relation to COVID, if that's okay. So I'll pick them both up together. So Pam says, hi all, just a question. With the new lockdown measures, are we able to continue to deliver meaningful social care day opportunities with strict COVID secure procedures in place? And I've also got one that says, a question from Lucy. My social worker didn't seem to know procedures, and a manager moved areas halfway through my case, all blamed on COVID-19, which I understand has had a massive impact. But if the social workers don't know procedures, how are things supposed to be getting done?
Yeah, okay, so I'll take the day opportunities question first. And I think we are, we're constantly reviewing this, but the issue is, when we look at a lot of the people that attend day centres, they're in amongst the highest risk groups we've got in Birmingham. And I think that's what's really making us very nervous about bringing people back when it involves sort of public transport, people being on transport and so on, and then those interactions that need to take place in the centres, and it's very difficult to manage that. So we've been looking at that very closely, and we certainly, are hopeful that at some point we will be able to bring people back safely. That's what we would like to do. But I think we have to take advice not only from the government but from our own local Director of Public Health on that, and we have to think about the safety and well-being of the citizens who use the services, the citizens who care for the users of services, and the staff who run the services. And that weighs heavily, I think, on our minds when we're looking at how do we bring people back. So what we have been trying to do, both with our own centres and with the independent providers, is to do everything we can with the resources we've got to engage people, support them in a wide range of different ways, often remotely, but really trying to do our very best to get, engage as many people as possible. But I do think the question is absolutely right. It's so difficult, because of what we're based on in adult social care is human interaction. That's what's at the heart of what we do, and that's what makes us unique and different in society, really, is because we facilitate that engagement, those interrelationships, and it is very difficult at the moment, but we will continue to try and do it. We're absolutely committed to that, and whenever possible we will, if we can, bring people together safely. So that's what I mean. In terms of the second question, I think that I will certainly take that away. I know June's recording all of these, and I will raise this with my team to make sure they recognise the importance of social workers knowing exactly what the guidelines and rules are, because they're pivotal in being that kind of conduit between what the advice is nationally and what we're saying locally. And it's really important that they do understand all the guidelines and can help and support our citizens, because, I think if we're all honest, you have to read it a few times to understand, well, what bubble am I in, and does that mean I can go in a garden or can't I, And it becomes particularly important, I think, for our citizens that we can support them to understand what the rules and guidelines are when we talk to them. So I think that's what we'll take that away. We've noted that down. So thank you for raising that. And it's certainly something I will pick up to make sure that we strengthen the importance of everybody knowing exactly what the guidelines and rules are and what the implications are for citizens. Okay, thank you.
Great. Well, we've still got some questions coming in, Graeme. Alan is asking, why is the vision so vague? When Cabinet vote on the vision, it appears to give adult social care carte blanche to introduce whatever they want to.
I wish it did. Yeah. No, I'm afraid it doesn't. And I wouldn't say it's vague. I mean, people often poo-poo visions and so on. But let me take you back to the part of the presentation where I talked about what it was like here. It was really at a point where people did not know what social care was about. It completely lost its way. And because of that, staff weren't able to deliver to their full potential. And because of that, our performance was really poor. That's the reality of it. By introducing the vision, we gave staff and our partners clarity about what we were trying to achieve. And that clarity guided our decision making about the services we needed to introduce, the performance we needed to drive up, and the way we needed to use our resources. That's because of the vision. So I wouldn't say it's vague at all. I think it's very clear about what it's saying, about what the important principles are that we build and deliver our services on. And because of that, we've seen real improvements in adult social care. We've got a grip on the budget now, we use our resources more effectively, we've driven up performance in a whole range of areas. So for example, if I just give an example to illustrate this, June, one of the things that one of the principles in the vision is about independence, choice, control, and so on. To do that, one of the important ways we can do that is giving people choice and control over how they get the money to spend on their care through direct payments. We were one of the poorest performers in direct payments in 2017. We're now in the top quarter. We're one of the best performers. And that means that our citizens have got more choice about their care, how it's delivered, when it's delivered, and all of those things. So I think the vision is absolutely critical in this. It's very clear what we're trying to achieve. And because we've got that clarity now, we can focus our energies under. And if you look at the vision, which was agreed for older people across Birmingham, so that included all the health partners, the community groups and so on. If you look at that, you will see that threads running through it, which came from the vision from adult social care. And I think because of that clarity of vision, people signed up to it, and we're now in a position where it's not just adult social care that's improving, but the services as a whole, the whole care and health system is now working much better because it's got that clarity of vision.
I've got one that just follows on from that. I've got a question that just follows on from that. So I've had a question in, it's an anonymous one. Is the vision of social care advocated by, and I don't know what these stand for, KONP, SHA and many others in social care? How do you think it relates to BCC's vision?
I don't know what that acronym is. Is it KON?
KONP. Maybe whoever posted that could actually just tell us what they mean. We're not, they're acronym. I know a lot of acronyms, but I've not come across either of those two before. But fundamentally, I think the question was, how do you think it relates to the City Council's vision as well, Graeme?
Well, I mean, very much so. And again, you can see, you know, the jargon for all this is the golden thread that runs through everything. And if you take the council's vision for Birmingham, which is a great place to grow, you know, a great city to grow old in, we're absolutely delivering on that commitment from the council. And I think that's where you can see, you know, the vision for the city council and the city and the vision for adult social care coming together with what our partners are trying to achieve as well. So I do think they all come together very well. As I've said though, things don't stand still. We're particularly keen to enhance the whole notion of social justice in there. And I think you'll find as the new Chief Executive's vision and approach develops, you will see that ambition there as well. And certainly some of the things that the new Chief Executive has been talking about, he's been talking about early intervention, he's been talking about prevention, you know, it's all the things that we're talking about and have got ahead of the game in a sense, because we've been prepared, because we've got a vision to invest in those areas. So you can see that thread running through them, and we certainly are at the forefront of delivering the council's vision.
Great. So next question from me. You're making me look. So the next question then, Graeme, is from Olivia. As well as awareness of the US situation, how has adult social care responded to Black Lives Matter with regards to engagement with police, hiring and promotions within adult social care structure, engagement with individuals in the community? And there is another one that follows on that's very closely related. The new vision has not brought a spotlight to inequalities. COVID-19 has exasperated the inequalities that need to be addressed.
Yeah, no, that is absolutely right. It has done that. It's interesting that again, the previous question was about our role within the city council, how it all fits together, and this is local. This is at the heart of local government. What I can do in adult social care has to be related to what's going on in the wider city council. We aren't a little independent company that can go off and do whatever we please. It's all got to fit together. So sometimes I feel I'm running after the council and catching up with what it's doing, and other times I almost feel, you know, we're getting ahead of ourselves. I think at the moment, the work we're doing in adult social care is a bit ahead of where the rest of the council is when it comes to the issues around Black Lives Matter. But there are some bits of it have to be done and must be done by the city council. Those broader relationships with other organisations like the police really have to be done by the city council. It wouldn't be appropriate for one bit of it to be doing things that other bits weren't. So there are bits which I think have to wait for the city council to get on with, but there are others I can get on with. And I think in one of the questions, what was mentioned was what we're doing with staff and so on. And if I can just take a minute to link these things, June, because I think what we're trying to achieve is a workforce that reflects the population. We've got a very diverse population, and it's great that on the whole staff reflect that, but that's also highlighted the broader challenges in society. So what we're concerned about is that I can see in more junior levels in the organisation we're very well represented, and we look very much like Birmingham as a whole, but in more senior levels less so, and that's the area we need to challenge. So we've put in place a programme to actually help break that down and open the organisation up so we're even more open than we are at the moment. So the concrete things that I can do and that are within my control, and that we've got a programme, as I say, that's underway to help us do that. But the other bits, working with the police and so on, I'll have to fit in with the City Council to do that.
Brilliant.
Right, cover both questions?
I think so. I've got another question for you. Next question then. How are BCC going to ensure we invest and support citizens who've been disproportionately impacted by COVID, especially those from BAME communities living with underlying health conditions such as sickle cell, diabetes and other long-term conditions?
Yeah, and this is part of what we're doing with the work we're doing now, which is contacting people, trying to understand their positions and whether they're getting the levels of support they need. And we'll also be doing that through a review process where we can begin to pick up some of these challenges. And certainly when I've been doing some of these calls, it's been interesting to hear people's feedback about how they've had to change their lifestyle, change things they do and so on. And what we need to do is get under that on a personal basis, so it's that individual one-to-one contact that's essential, so that when we do reviews, for example, we can pick up are there particular issues or challenges related to people being from Black, Asian and minority ethnic groups. COVID exposed this in a pretty harsh and brutal way, so we need to make sure we respond to that effectively. And that's what I mean about the link between the population and the staff and the people that do provide care in Birmingham. If you look at the nature of the workforce, we have got an over-representation of Black, Asian, minority ethnic groups within the workforce, which is great, as I say, from my perspective. It's brilliant because of the diversity. It means we can reflect what the citizens need and want, and there's a depth of understanding there that we wouldn't have otherwise. But it does also mean we need to think about the staff and how they are protected as well. So it's linking those things, I think, is really important now, and I think we're beginning to do that in a way that we wouldn't have thought about before COVID. And I'm not saying that's a good thing. I'd rather we hadn't had COVID, obviously, but nonetheless we need to see those things that have come through, learn from them and try and improve them. And certainly, when you look at some of the statistics about the impact of COVID-19 on, for example, people with disabilities, you recognise we need to make sure we're doing more to protect them, which is why I spoke about the day services and the way I did. We know we've got to increase interaction, we know we've got to engage people, but we have to do it safely.
Absolutely. I've got a couple of questions on day opportunities. A couple of questions now around day opportunities, Graeme. One of them is from Alan, is quite honestly, he's asking if we're intending to close day services. And the second question is from an anonymous poster who says the cost of access to digital connectivity has become a social injustice issue. How are you working to address this, especially as day opportunities continue to be shut down and causing isolation for some of our most vulnerable citizens?
I think I've been clear all the way through this conversation with people that we're looking to see how we can open day centres safely. So I'm not going to say any more about that because I don't think it would be any plainer really. On the second point, that's an excellent point actually. I think it's a really good point, and it's certainly one that has come up during, I think, in conversations you've been involved in as well about digital inclusion and so on. And I'm sure others in the team like Simon will recognise this as well. The technology is great as long as you can afford and get the technology. It's no any use if you can't. So that is certainly an area we need to look at. And I've been quite happy to talk to people about the importance of seeing this as something that we do support people with. Whether that's in terms of the equipment kit, the know-how to use it, or so on and so forth.
Yep.
We can certainly link some of the groups to that to make that happen. We are looking more broadly at the whole area of technology and how it can improve the quality of people's lives, and certainly that notion of digital inclusion is part of that.
Cool. So next question. Next question is from Dawn Durrant, Clinical Lead for BCAT. It is so important to use creativity and the arts at the moment to raise the profile of care homes, support mental health and improve well-being. The arts are accessible to all and moving forward with a wonderful way to bring together a community that has suffered so badly from COVID. Dawn then went on just to say intergenerational work could really bring communities together. More of a comment, I suppose, than a question.
Dawn, I think Dawn's absolutely right, and there's not much I can add to that really, because I think she's spot on. And you know, I mean, it's how we do that and do it safely becomes the question. And at the moment, that's clearly a concern because of the vulnerability of older people. So we need to be bearing that in mind. But again, you know, I'm sure you know people have been using the digital tools that we've got, video conferencing, to link, you know, grandchildren and grandparents and so on, to keep those links going out. So there is lots we can do, and Dawn, you're absolutely right. What we need to do is see how we can develop that and how we can take it forward, and we're very open to you know, creative thinking about that. You'll be aware, you know, that there are projects. Zoe Worko has been at the forefront of this in terms of intergenerational work. We're very supportive of that approach. So anything that we can help with or develop, you know, do come back to us. We're very open to, you know, to working in that way.
Great. Next question. Next question is from somebody anonymous. How do we ensure that co-production and citizen partnership isn't tokenistic? I'm assuming that's around the vision.
Yep. I mean, I think it's, I mean, one of the key principles that the vision is built upon is around co-production. And I think over the past 3.5 years, we've made really great strides in that area. I've seen, you know, been at and witnessed some fantastic events, you know, around direct payments, for example, and in many other areas where we've looked and focused on a particular area. I think we're weaving that in all the time. We're involving citizens and recruitment panels all the time. It's not, you know, it's not just a one-off tokenistic thing. It's part of how we do things here. And you know, I think we're improving all the time, but we can always get better. We're always open to ideas about how we can improve and so on. And then I think the work of June and Simon and others in the team, you know, and the work of good people like Beatrice and so on, which are, you know, which are helping to take all this forward. It's absolutely critical in it, you know. So I think it is a bit. It's not just about, you know, one thing or one person or anything like that. It's about all of us saying we don't do things unless we're doing it in a co-produced way. So I don't think it was never meant to be tokenistic. It was always meant to be part of what we've done, and I think we're getting better at it over time. And again, I would say the evidence is there to be seen. You know, we know people do feel much more engaged than, you know, 3.5 years ago. But we can always improve. I would never say, oh, we've nailed it, it's perfect here. There's always ways we can improve, and we're keen to do that with people.
Yep. Next question, and I think we've covered some of this, and I think you'll know this off the top of your head. So when COVID is over, what has been learned be taken forward, or will it be considered a strange time in which nothing can be learned from?
Yeah, it's a good question. That's always the risk, I think, that you get over something that's been difficult, challenging, you breathe a sigh of relief and off you go, and you know, and we must learn from this. I think the bits we've highlighted really about the way COVID has exacerbated inequalities, the way it's really drawn attention to it, we've got to learn from that. That's why we've strengthened the vision by putting more in on social justice. So I think there needs to be a learning from it. We've certainly begun to have conversations with people like Dave Rogers around how we learn, how we improve, how we develop, and so on and so forth. And the intention is to do that more widely. So yes, lots of learning from staff, from citizens, from partner organisations. We can learn from this. We can improve. It's like everything, you know, when you had an adverse experience, you learn from it it makes you stronger, hopefully, and that's what we're intended to do. If I look at the neighbourhood networks, which I went out and visited a few weeks ago now, I mean, they have grown enormously during this period because they've had to adapt really quickly to the circumstances they find themselves in. So, for example, they may have agreed a commissioning agreement to deliver X. That X became impossible from day one, so they've had to think how do we deliver Y and Z and A and B to make sure that the citizens that they're meant to be serving do get the support they need. So, you know, everybody has, I think, responded well in the circumstances, but as you say, it's about consolidating the learning and making sure we all move forward together as a result of it.
I think we've got another question in if you want another one, Graeme. I'm just very conscious of time, so perhaps we'll take the first one. In fact, there's two of them. First one's a statement. So Jackie, who's from the Home from Hospital Care team, says we're offering free electronic devices to vulnerable Birmingham citizens so that they connect with family and friends and support groups. Training is included for people who are not familiar with tablets and phones, etc. So that's a positive comment. We also have, and this is an interesting one, this is switched us to our commissioning way of working. COVID has revealed the crisis of the dominant privatised model of social care. BCC has several hundred contracts with private contractors. What change in the current model would you like to see?
Well, I mean, just to pick up and thank Jackie for that comment. I think it was really helpful, and I think it's really pleased to hear that. I think it's excellent. But you know, at another level, Jackie, I'm not surprised because you do such great work. So you know, well done, and keep the good work going. In terms of the relationships with the independent providers, I mean, it's been very interesting. I think it's in many ways it's made us work more closely together to understand the challenges they face, because they in a sense, like many other bits of the economy, they must have felt they were on their own in those first few weeks. And really, I think we have improved and developed those relationships with them. That's got to be a strength moving forward. And really, what we're keen to do is to support and develop our independent providers, because the vast bulk of people who receive a social care service in Birmingham do receive one from an independent provider. So that's the way it is. What we've got to do now is ensure we get the best quality and the best value from those relationships, and that's what I think we are beginning to see more of. So I do think there's still learning to be had, but nonetheless, we can build on the relationships we've got, and I think if we can do that, we will continue to improve the quality of the services we're able to offer our citizens.
Great. So I'll do the last question then, Graeme. Last time we'll put you on the hot spot this afternoon. So this question basically says, we need at this time to give the care plan budget to family members looking after vulnerable adults. Can we have this in place plus budget not spent to allow them to use it on digital technology to help them communicate to various people, and can we train them better?
Certainly, I mean, I think the aim for people like myself really is to try and get the money that does come through from central government to local government to the citizens who need and deserve it. That's really what we should be trying to do. So, you know, I think, you know, whoever asked that question, I would say, yes, I'm in a similar place. That's what I believe we should be aiming to do. I think the question then becomes, how do we support people to do that effectively? Because there's nothing worse than saying, there you go, get on with it, and hoping for the best. Our responsibility and accountability goes further than that. So I think it would be really useful, and it will be part of the learning about how we do ensure that we see that digital offer as part of what we do, what we do fund and so on. We talked about digital exclusion, people not being, you know, feeling that they are included in all of this. So we do need to tackle that. And then we need to make sure we've got in place the support for people. Now, I would see that generally being done by local community groups. I think that's the most effective way of delivering it. So as part of the neighbourhood network services, I think we're getting a better understanding of what's needed at a very local level, the support people need, the development, the training, all of those things, and the kind of access to the kit. So I do believe that we should be doing that through the resources we make available. And also I'm very happy to see how we can develop the support that we offer to people so they can make the most effective use of it. June, you're on mute.
It's gone to Beatrice.
Gone to Beatrice, lovely.
Oh, thank you very much, Graeme. Thank you, the team, and John. Thank you very much, everyone. I am Beatrice Miaska again. How was your meeting today? We hope you enjoyed the meeting, and we will want to hear again from you. Please get involved or send us a view in the email, the link below. And thank you very much for your time today. And please let me introduce you our next meeting, the date of our next meeting for the People for Public Services Forum, which I am also a member of. It's going to be on the 17th of November from 2 o'clock, like today, to 3. Thank you very much again. We like to hear from you. Thank you.